Okay, Brad and I have seen well over 1,000 patients with sciatica in our careers. Stick around to see what we have learned.
It's going to be interesting.
Right.
Bob and Brad, the two most famous physical therapists on the internet.
Number one, Brad.
Yes.
We got to stop making it worse.
Right.
So we're going to demonstrate how you make it worse. You go ahead with the cups in place.
Right. So this represents the lumbar vertebra, L4 and L5, and the red ball represents the disc. And the disc is what bulges into the nerve, creating the pain and symptoms down the leg.
And what does that, Brad? This.
Flexion forward,
Right,
in the
bend it
majority
forward.
of the cases, right?
And the majority.
So when you bend forward,
Repeatedly
Yep.
or at length.
ooh, and the further, the longer you let this go on, the bigger the bulge gets, the more
And
of
what
a
does the
pinch.
bulge hit?
The bulge, well, it could hit a couple things, but
Right.
typically the peripheral nerve
Right.
into the,
The
sciatic
spinal nerve.
Yep.
Right.
If it could go into the main canal.
Right.
And then you
Hit
have,
the spinal cord.
yeah, that's bigger problems.
Number two, we want you to start walking as soon as possible. And generally, it's going to feel better with short strides and also flat surfaces.
Right. Avoid the hills, downhills, uneven surfaces, and don't walk too far too soon. Build up gradually as tolerated.
Very good. Number three, as much as possible, we want you to avoid sitting because what happens is your spine tends to flex. So if you're going to sit, use a lumbar roll.
Right. And particularly if you sit rounded and not aware of it. So if you have to sit with good posture and use a lumbar roll like we have here. Depends on what size you are, and your chair will depend on what size lumbar roll to get. So you want
You
to
might
sure.
start with a roll towel,
Yep. And
they come in a plethora of sizes, right?
Like this one's pretty narrow. This one's bigger around, depending on the size of the individual or your chair that you're sitting in. It usually the bigger the person uses a bigger roll. Okay, with sciatica, the symptoms are very common: pain or numbness or tingling going from the back down the leg,
Burning.
Yep. All the way down into the foot and sometimes into the toe.
Right.
The red marks represent where the symptoms are with Bob. Now, when you do the exercises we're going to demonstrate, the idea is if you can get the symptoms to centralize, in other words, the farther away from the back, they need to disappear first and work their way up. So, example, if Bob does one of the exercises, and he has initially symptoms to the ankle like this, he does the exercises 10 times, he gets done, and that symptoms, those pain is gone.
That's good.
That is really
Right.
good. We're happy. On the other hand, if they stay down here and the pain gets better up here, that's not good. We want to start distal, or that's why it's called centralization.
Right.
Keep doing the exercises, modify them a little bit, and if the pain...
Better yet?
Yep. The more the pain centralizes to the low back, this is considered the center. Oh, there we are over there. And we've had this many times.
Right.
Where, oh, my leg pain is gone, but now I feel it in my butt. Continue
And
exercises.
it's real subtle.
Yeah, it is. Sometimes people forget about it because it's not
Right.
hurting anymore.
Right.
Then I have to ask them, or Bob doesn't. Then they say, oh yeah, there's nothing there anymore.
Right.
And when you get the pain to the center, like this spot right here, boy, you know you're gold. Things are looking really good.
And eventually that'll go away too.
Exactly right. So that's the whole concept of the McKenzie theory.
Right.
Is it a theory?
No.
No, it's
Proven.
what?
Theorem? I know.
No, I'll think of it. Okay, this is one exercise that we commonly start with and see how it responds in regards to centralization. We get it in the all fours position like this. Quadruped, we call it in the therapy world. And then we do the cat camel. So Bob, I don't know what is a cat and what is a camel, but he's arching this way and then he rounds that way. And you see how your back and leg respond. If you get some centralization, this may be one you continued.
Or if it makes it worse, stop.
Then you stop, go on to the next one. To be honest with you, I have not used this
Right.
as much. I will use it some, but usually it doesn't help early on in the symptoms.
Right.
But it's worth a try. Okay, someone comes into the office, they got sciatica. I'll have them ask them if they can lie down on their stomach. They say, no, that hurts when I land on my stomach. So I'll put 2, sometimes 3 pillows under their waistline or stomach, and then it becomes tolerable and actually comfortable. And at that point, we can see if the pain or the numbness tingling centralizes. And sometimes just doing this for 30 seconds, it'll start to centralize. Then, as it does centralize, you remove one pillow and drop down. And it's amazing how this works, because then it's like, oh, some of that pain came back in the leg, but you give it about 30 seconds, maybe a minute, and it starts to centralize again. If that's the case, you take another pillow away, and then we'll continue on. We got exercises that will progress the progress. Progress the progress.
Yeah,
That's a lot
there
of
we go.
Ps. All right. Okay, moving on. It's very simple. You're lying flat without any pillows.
Pillow.
And this is typically not on a bed unless it's a real firm bed. But it's simple. Is put your fists like this, and Bob, demonstrate. There you go. And what that does is elevates the head and the shoulders, which puts a little arch in the back, can help centralize that pain more. See how it responds?
It's from Stuart Bigelow.
Yeah. Okay, we're going to the next step. After the fists under the chin, things are improving or tolerate the position more. We continue to rise up, prone on elbows, and you can see the arch coming in the back. Continued
I
centralization.
just prop up.
Right now, if you have success with any of these, you're not going to just do them once a day. You're going to do them up to as many as once every 2 hours, but at least 3 times a day.
Yeah, very critical.
Yeah, as long as you continue to do it and you have good response with centralization, you can really go up to 8 times a day.
Yep, great.
Once the prone on elbows is tolerated well, then you go to the Micropressups, or a lot of times in the clinic I call them baby press-ups.
There you go.
Whatever trips your trigger, whatever.
Hands underneath the shoulders.
Yes. But look at this. Bob has his waistline glued, so to speak, to the table, not this. We want range of motion, the arch in the back. And when I have a patient, I'll actually put my hands here to make sure they understand that clearly. And oftentimes they'll say, oh, that feels like good pressure. Once the baby press-ups are tolerated well, it's time to move on to the full press-up. Bob will demonstrate. He locks his arms out. He relaxes when he's up there, and we get that nice arch in the back.
Not doing this.
Not that, absolutely. Yep, there you go. Boom, all the way up.
All right.
Moving on, once the full press up is tolerated well, doing 10 of those, it's time to add some overpressure. In the clinic, the therapist will actually manually put pressure on here. At home, we teach our patients to put a belt that goes around the waistline and trapped under the hands so that it stops there, and a little overpressure is experienced. Either a belt that is not shiny works better, so like a canvas belt, or you can use a sheet like this, and that works well. You can improvise as depending on what you have available. And once that's tolerated well, you'll do 5 to 10 of those, and we're really moving on well, because by this time, the pain is centralized and actually going to the point where it's gone for part of the day. Again, do these repetitively throughout the day as long as they have positive response.
Very good.
Now, you might find yourself coming along on the exercises we just did, and then you get stuck, and all of a sudden things aren't going. They're not progressing. Maybe some pain comes back down the leg a little bit, and you get stuck. And that's not uncommon. It happens. We do have tricks for that. And the first trick we call is the banana. So when you're lying
This
down,
is the leg pain.
okay, good. So if this leg has the pain, pardon me, we're going to take the hips and shift them that way. Pain's in the left leg, shift the hips to the left. Are we on that?
To the right.
Yeah, thank you, Bob. We're over there. So you can see his body is skewed kind of like a banana. That's why we call it the banana. And with that, you may have to wait 30 seconds or more. And if that takes the pain away from the leg, which we've seen that many times, you know you're on the right track. You're going to do this, and then you can start doing baby press-ups while you're in the banana. You won't go near as high. It's going to feel different. But again, we're looking for centralization from that leg to the central back. Now you've tried the banana. It's not working. You still have pain in the leg, pain in the back. It's not improving. So again, pain is down this leg. We're going to do a technique. This is kind of a weird name, but it's been called Roadkill. So it looks like this. You take the painful leg and shift it up to the side, and looks just like this. And I've had a number of patients, as soon as they do this, they say,
Oh, that feels good.
it feels a little bit better. And then you give it another minute or so, 30 seconds, and it continues to feel better. Oh, we're over here. Good. So, and you can add baby press ups with this. Again, you won't get near as high,
Right.
but you continue. And I've had people feel good with Roadkill and do press ups with the Roadkill, and it's doing very well. So that's another option. Let's go on. All right. And if the Roadkill is giving you problems, you can try this. You take a rolled up towel, so it's about 4 inches in diameter, and then you put it under the side that has the pain or the symptom.
Under the pelvis.
Yep. So it lifts up here, and you may shift it around because he's kind of got it under his thigh.
Oh, sorry about that.
That's all right. And then he's got a little twist in here. And actually, while you're doing this, you can shift your hips right to the left a little bit, looking for
Right.
the location that makes the leg feel better. It's amazing how a little shift can really make a big difference at times.
Okay, once things have gotten better and you're able to progress to this, you can do some standing press backs.
And actually, you'll be walking by this time for
Right.
part of your therapy distances. Bob is going to do it with his hands for support.
Right on my pelvis, bend back.
Yep. And how many repetitions, Bob?
10?
Yep. Usually, sometimes they'll say start out 3 to 5, but work yourself up to 10, not more than 10.
Again, should feel fine.
Yes, it should feel like a good stretch. You can take a belt, and I've had a lot of people do a belt or a towel roll, put it around. And I like this because you can get real specific. Sometimes if it's low, it doesn't feel so good, and you adjust it to a certain level, and then you hit the sweet spot, and then you say, oh, that's the spot. So you do adjust a little bit, and you can do that with your hands as well.
Again, this will probably be later.
Yes. Yep. Later on, you're doing fairly well at this time. And this is where the point you got to not overdo things.
Right.
Like, don't go back to lifting and forgetting.
Right. All right, there you go, Brad. 15 pearls of wisdom.
Right. These are things that we've done over the years and
Right, over 100 years, right?
100 years, yeah. So take your time with these things. You're going to have success. We know sciatica can
And
be real pain.
what can we fix?
Well, Bob, we can fix everything except
A broken heart.
yeah, it's that broken. Yeah, whatever. When we're working on it, we continue to, and it's an effort. And
We're running out of excuses.
yeah, but we won't stop. It's just carry on with your back problem.